3-minute blood draw. Simple test, results in days, but this test has divided the medical community for 20 years. Some doctors say every man over 50 should get this test annually. Early detection saves lives. Other doctors say this test causes more harm than good. Stop recommending it. The test, PSA, prostate-specific antigen, most men have heard of it. Few understand what it actually measures or why doctors disagree so strongly about who should get tested. Here's what makes PSA testing so controversial. The test is extremely sensitive, detects prostate cancer early, sometimes very early, but that sensitivity creates a problem. It also detects slow-growing cancers that may never threaten your life. Study from New England Journal of Medicine. PSA screening prevents 1 to 2 prostate cancer deaths per 1,000 men screened over 13 years, but causes 120 men to be diagnosed with cancer, 80 to receive treatment, many experiencing permanent side effects. That's the dilemma doctors face when recommending or not recommending this test. Today, exactly what PSA test measures, how it works, who benefits from testing, who doesn't, the age when testing makes sense, and the questions to ask your doctor before deciding. Because PSA testing isn't right or wrong, it's right or wrong for your situation. Now, before we move on, a quick reminder. This video is for educational purposes only. It's not medical advice, and you should always discuss PSA testing decisions with your doctor, considering your individual age, risk factors, and health status. And if you'd like a free PSA testing decision guide, just comment the word baseline below. You'll find the link waiting in the pinned comment. It's a simple one-page guide covering when to test, what results mean, and questions to ask your doctor. Now, let's start with the basics. What exactly is PSA? PSA stands for prostate-specific antigen. It's a protein produced by cells in your prostate gland. Every man produces PSA. It's completely normal. The protein serves a specific biological function. After ejaculation, PSA liquefies semen. This helps sperm move more freely. Most PSA stays in prostate and semen, but small amounts leak into your bloodstream. This leakage is also normal. In healthy men with normal prostates, PSA blood levels typically range from 0.5 to 4.0 nanograms per milliliter. Nanogram is tiny amount, 1/1,000,000th of a gram, but certain conditions cause more PSA to leak into blood, raising levels above normal range. Condition 1, prostate cancer. Cancer cells produce more PSA than normal cells. Cancerous tissue also more likely to let PSA leak into bloodstream. Condition 2, benign prostatic hyperplasia, BPH, non-cancerous prostate enlargement. Bigger prostate simply makes more PSA because there are more cells producing it. Condition 3, prostatitis. Prostate inflammation from infection or other causes. Inflamed tissue releases more PSA into blood. Condition 4, recent prostate stimulation. Ejaculation within 48 hours. Vigorous exercise. Bicycle riding. Digital rectal exam. All can temporarily elevate PSA. So PSA test measures this protein in your blood. Elevated level doesn't automatically mean cancer. It means something causing your prostate to release more PSA than typical. The PSA test is straightforward. Simple blood draw, usually done during routine physical exam. Lab technician draws small amount of blood from your arm. Same process as any blood test. Sample sent to laboratory. Lab measures PSA concentration in your blood. Reports result in nanograms per milliliter. Results typically available within 1 to 3 days. No special preparation needed before test, though some doctors recommend avoiding ejaculation for 48 hours before test and avoiding vigorous exercise or bicycle riding day before test. The cost, usually covered by insurance for men over 50 or those with symptoms. Without insurance, typically costs $50 to $150. Total time investment. 3 minutes for blood draw. 1 follow-up call or message to review results. That's why the test seems so simple and appealing. Minimal time, minimal discomfort, potentially life-saving information. But interpreting results is where complexity enters. Traditional interpretation, PSA below 4.0 considered normal. PSA above 4.0 considered elevated, warrants further investigation. But research has shown this cutoff oversimplifies reality. More accurate interpretation considers age-specific ranges, age 40 to 49, normal range 0.0 to 2.5, age 50 to 59, normal range 0.0 to 3.5, age 60 to 69, normal range 0.0 to 4.5, age 70 to 79, normal range 0.0 to 6.5. Why do ranges increase with age? Because prostate naturally enlarges as men age. Bigger prostate produces more PSA even without disease. PSA of 3.8 might be concerning in 45-year-old, completely normal in 70-year-old. Additionally, PSA velocity matters as much as absolute number. PSA velocity, how fast your PSA is rising year over year. Research from clinical chemistry, PSA rising more than 0.75 points per year significantly increases cancer risk, even if absolute numbers still within normal range. Example, man has PSA of 2.0 for 3 years, then jumps to 3.5 the 4th year. That rapid rise of 1.5 points in 1 year more concerning than man whose PSA has been steady at 4.2 for 5 years. This is why single PSA test provides limited information. Pattern over time tells more complete story. What happens if PSA is elevated? First step, repeat test. Ensure elevation not temporary from recent activity or lab error. If still elevated, digital rectal exam to feel prostate for abnormalities. If still concerning, possible multiparametric MRI to visualize prostate. If MRI shows suspicious areas, targeted biopsy to obtain tissue samples. Not every elevated PSA leads to biopsy, but pathway exists if elevation persists and other factors suggest cancer risk. This is where medical organizations disagree. American Urological Association recommendations: men age 55 to 69 at average risk, discuss PSA testing with doctor, shared decision-making based on individual factors, men age 45 to 54 at increased risk. African American men or men with family history should discuss earlier testing. Men over 70 or with less than 10 to 15-year life expectancy. Routine screening not recommended. U.S. Preventive Services Task Force recommendations. Men age 55 to 69. Individual decision after discussing potential benefits and harms with doctor. Men under 55. Do not screen routinely. Men over 70. Do not screen. Notice the overlap in age 55 to 69. Both groups say this is the age range where testing might make sense, but requires individual decision. Why this age range? Before 55, prostate cancer rare. Screening harms likely outweigh benefits for most men. 55 to 69, prostate cancer more common. Enough life expectancy to benefit from early detection if aggressive cancer found. After 70, most prostate cancers slow growing. Many men will die of other causes before prostate cancer becomes life-threatening. Treatment side effects may outweigh benefits. Exception: men with symptoms like difficulty urinating, blood in urine, or pelvic pain should see doctor regardless of age. These symptoms warrant evaluation even if routine screening not recommended. Research helps identify who gains most benefit from PSA screening. Group 1. African American men. 60% higher prostate cancer incidence. Twice as likely to die from disease. Screening starting at age 45 recommended. Group 2. Men with family history. Father or brother diagnosed with prostate cancer before age 65. Risk doubles to triples. Consider testing at age 45. Group 3. Men with genetic mutations. BRCA1 or BRCA2 mutations increase prostate cancer risk. These men benefit from earlier, more frequent screening. Group 4. Men age 55 to 69 in good health with life expectancy over 15 years. This group most likely to benefit from early detection of aggressive cancers. Group 5. Men who had very low baseline PSA at age 40. Study from European Urology. Men with PSA below zero point 0.5 at age 40 had 96% lower risk of aggressive cancer by age 60. But that early test established valuable baseline. Conversely, who benefits least? Men over 70 with other health conditions, life expectancy under 10 years, unlikely to die from slow-growing prostate cancer before other health issues. Men who would not accept treatment even if cancer found. If you wouldn't treat it, no benefit from detecting it. Men who strongly value avoiding unnecessary medical procedures. For some men, anxiety and intervention from false positives outweigh peace of mind from testing. Understanding why doctors disagree helps you make informed decision. Pro-screening perspective. European study of 182,000 men. PSA screening reduced prostate cancer deaths by 21% over 13 years. For men with aggressive cancer caught early, treatment can be life-saving. Gives men and doctors information to make informed decisions about treatment. Anti-screening perspective. Same European study, no overall survival benefit. Men didn't live longer overall, just died of different causes. For every 1,000 men screened, 120 diagnosed with cancer, but only 1 to 2 deaths prevented. Means most diagnosed cancers wouldn't have caused death. Treatment causes permanent side effects. Incontinence, erectile dysfunction, bowel problems. The middle ground most organizations now recommend: informed decision-making. Doctor presents benefits and harms. Patient decides based on personal values and risk factors. Shared decision-making means understanding what you're agreeing to before you test, knowing potential downstream consequences, including biopsies and treatment. Not getting tested because doctor ordered it routinely. Getting tested because you understand what information it provides and what you'll do with that information. If you're considering PSA testing, ask these questions. Question 1. Based on my age, race, and family history, am I in a group that benefits from PSA testing? Question 2. What would we do if my PSA is elevated? Would you recommend immediate biopsy, or would we monitor over time? Question 3. What is my individual risk of prostate cancer based on all my factors? Question 4. If we find early-stage cancer, what are my treatment options, including active surveillance? Question 5. What are the chances a positive test would be false alarm? These questions ensure you're making informed decision, not just going along with routine testing. Let's recap. PSA test measures protein produced by prostate. Elevated levels can indicate cancer, but also indicate benign conditions. Testing most appropriate for men age 55 to 69, especially those at higher risk. Requires shared decision-making because benefits and harms closely balanced. Understanding what PSA measures, how results are interpreted, and what happens with abnormal results helps you decide whether testing right for you. Remember, comment baseline for your free PSA testing decision guide. If helpful, tap like and share with men approaching age where PSA decisions become relevant. Subscribe because next week we're covering what happens after elevated PSA result, including the MRI first approach that reduces unnecessary biopsies by 50%. PSA testing, not right or wrong. Right or wrong for your situation, your age, your risk factors, your values, informed decision, your choice.